Hi, my name is Anatoly Doroteo. I am a student in University of San Francisco, master's degree program in clinical nurse leadership. I'm doing right now is a basic abdominal assessment, which leads to four parts. I have my patient right now. His name is Robert. Hi, Robert.
Hello.
How are you doing?
I'm good.
So the first part of the abdominal assessment that we're gonna do is the observation. Robert, part of the abdominal assessment is that we're gonna expose a little bit of your abdomen for us to be able to showcase and see for them how we're gonna assess the abdomen. Is that okay for you?
Yes, I'm ready.
Okay. The first thing you're gonna do is the observation. So can you lift up your t-shirt for me real quick? So observation or inspection, you want to observe any vascular changes, the contour, the shape of the abdomen, any peristalsis movement, any positions of the abdomen. As you can see right now, Robert's abdomen is like he's breathing and he looks fine. The second part of abdominal assessment is going to be the auscultation. Auscultation entails to use a stethoscope. For you to be able to do that, you have to assess four parts of the abdomen, which is the right upper quadrant, the left upper quadrant, the left lower quadrant, and the right lower quadrant. So you want to use a stethoscope. It's going to be a little bit cold. Okay, let's start with the right upper quadrant, left lower quadrant, left lower quadrant, and the right lower quadrant. Actually, ideally, you want to listen to each quadrant like each 1 full minute, and you want to listen to the tinkering and the pinking of the abdominal sounds. It usually lasts between 5 to 30 per minute. The next abdominal assessment that we're going to do is percussion. Percussion usually takes like a practice, and for you to be able to do that is you want to use your dominant finger and by striking the mid portion of the distal finger of your non-dominant hand, which you're gonna go like the four quadrants too, which is the right upper quadrant, like strike, 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 and then you lift it up. Percussion usually outlines the tympani and the dullness of the abdomen, and at the same time, too, it identifies any enlarged portions or organs or fluids of the abdomen. The next part of the abdominal assessment will going to be palpation. So for you to be able to do that, you want to start in the light palpation with the four quadrants too. So for you to start, I want to use um, my hands with, for you to have a light palpation. Of course, you're going to use the four quadrants also. You want to use the light palpation because it want to entails for the abdomen for them to get used with your touch, and at the same time too, it relaxes the abdominal muscles, and that we're gonna go directly uh, to go with a deeper palpation. With this right upper quadrant, when you depalpate, you wanna be able to feel the liver border. For you to be able to do that, is you wanna push up, we wanna push down and up, and then goes to the costal margin. And you want to ask to breathe your patient to have a deep breath. So when I push down, Robert, you want to have a deep breath. Okay. So you want to push down and up. So you actually you'll be able to feel the liver border. And pretty much the same. That's the same thing you're gonna do on the left upper quadrant, which is the spleen area. So push down and up, Robert. And you'll be able to see the costal margin. Normally, you would not be able to feel the spleen over here because when you palpate the spleen, it means there's enlargement of the spleen. So that's not good. On the right lower quadrant, which is usually the appendix, you want to push down. So you want to see any pain for that. And then on the left lower quadrant, you usually will be able to like feel the colon part. Now, one of the special tests that we can have is the rebound test. Rebound test is when you depalpate and then you let go, and then you want to ask the patient which one makes it more painful, when you had the initial pressure or when the time that you actually let go of the hand, this or the rebound. This entails an abnormal findings, usually caused by peritonitis or appendicitis. Um, so right now, I think we're done finished with the abdominal assessment. I hope you were able to learn something. Thank you and have a good evening.